right, now to our Health Watch, where we discuss all the topics that are trending in the medical world. As always, happy to be joined by Dr. Syad Hussain from Trinity Health of New England. Good to see you again,
Thank
Doctor.
you.
All right, we're talking about a crazy virus. Have you heard of the Marburg virus? It's not new, but the CDC is now issuing a travel warning for people headed to Guinea and Tanzania to be extra cautious, because this is no joke. This is a very deadly virus.
Right, Tim, and we'll talk a little bit about the virus, but if we can learn anything from the two recent public health emergencies, Mpox and COVID-19, is that we live in a global village.
Yes.
Cases can arise, pop up anywhere in the world, so we need to be cautious, aware, and informed. So the Marburg virus is a cousin of Ebola, and it causes, the symptoms include high fever, body ache, sore throat, and just a lot of uncontrolled bleeding from all orifices. It carries a very high mortality rate of 90%, up to 90%. There are no treatments or vaccines, so that's why it's really important that folks in Equatorial Guinea, which is on the west coast of Africa, or Tanzania on the east coast, are aware of where the outbreaks are happening, and there's a 3-week quarantine period for symptoms to develop.
This is not a virus that very easily spreads, though, is it?
It's spread by contact with body fluids or contaminated surfaces. Definitely not like respiratory illness like COVID-19 or influenza, but nonetheless, folks need to be aware of where the outbreaks are currently happening.
Right, so there you go. Just keep in mind those two countries specifically. That's where the travel advisory is. All right, let's talk about cool new technology, a new artificial intelligence tool. I guess it's being used with already known brain tumors to try to figure out how to treat them better?
Yeah, this is a new tool that researchers are looking into. It's promising, and this gives us a window of how artificial intelligence can really work with medicine, especially in some of our most deadliest diseases, Tim. So diffuse gliomas are a form of brain tumor that are very malignant. The median survival rate is around 18 months from the time of diagnosis. So this tool will be able to detect patients who will be amenable to either chemotherapy, get enrolled in a clinical trial so that we can develop medications for these individuals, or if they're surgical candidates. So all in all, it will increase the time in terms of potential survival for individuals if they're detected earlier on in their disease state.
And my understanding is it can detect these genetic abnormalities in about 90 seconds. You just
Absolutely.
Feed. I imagine that could make it so they could sort of take a sample, test it, and maybe even make decisions on the spot?
So this is actually a screening tool that would be used, which it comes before the actual surgery takes place.
Oh, okay.
The gold standard for detecting diffuse glioma is molecular markers, because there are lots of subtypes within this tumor category.
Yes.
But those tests are rare, they're hard to find, and they can take up to a few weeks for results to come in. So this is why this tool will enable doctors to get to a diagnosis earlier on.
Okay. That's good to know. Yeah, a few weeks down to 90 seconds. Very good. All right, this eye drop problem. Global Pharma Healthcare was the ones who were making it. People were dying, or at least deaths associated with it, people having to have their eyeballs removed. What did the FDA find when they looked into this?
Yeah, there's so many cases, Tim, as of mid-March across the United States that showed a very rare bacteria, Pseudomonas aeruginosa, associated with these eye drops that are actually made in a facility in India. The FDA did do an investigation and found that sterilization techniques were not up to par. They weren't using aseptic techniques, so it's not a surprise. And there have been deaths associated with these eye drops, along with loss of vision. So it goes on to tell us that there needs to be more stringent standards when it comes to getting these medications, even over-the-counter medications, from overseas.
I apologize if I'm squinting. I have one of these things. I was looking at this video that people are seeing while you were talking, and it's of people putting in eye drops, and I'm one of those people. I can't see that without my eyes reflexively watering. Artificial tear commercials make me cry. But thank you so much. Yeah, very interesting stuff there. Yeah. Curious to see how these were able to make it through quality control to get into the country in the first place. But that's a discussion for another time. Doctor, thank you so much for joining us today.
Sure.
Sorry that I'm crying while you're talking.